So if you have a question, you can type it in the chat box. But if you have a mic and you want to use that, just let me know and I'll unmute you and so that you can ask your question with your mic. Uh, Feel free at any time. I'll keep an eye on the chat box. So anytime you have a question, feel free to ask it. I'll do my best to answer it. If I don't know it, I'll be honest and let you know I don't know it and see what I can find out about it. Okay, so our first surgery that we're going to be talking about is tympanoplasty. And usually this is done to repair a hole in the eardrum. It can be performed either under general or local anesthesia, kind of depends on how serious it is, or, maybe the age of the person. Sometimes it also depends on what the person prefers, and I'm one of those that would prefer to be just put me under, put me to sleep. Basically, what they do is, excuse me, they make an incision behind the ear to enter the ear canal, or they can go right through the middle ear. Then they elevate their eardrum away from the ear canal and lift it forward. And if some of these pictures are kind of, as you can see, they might not be the nicest thing. So if you are, that kind of stuff bothers you, just kind of close your eyes. Don't look at the pictures. I actually thought about putting in some short videos, but well, I have a kind of a weak stomach and I can't watch that kind of thing, so I thought it might not be the best idea. So then what they do is they use what they call an operating microscope. And basically an operating microscope is just like a microscope you have on a desk. It's just really big and it's on rollers so that the surgeon can use it to see inside the ear. And this is kind of a picture of what he would see if he was using an operating microscope. So he can see inside the body without actually having to cut it open and get in there. Now, if it's just a small perforation, they can usually use the operating microscope to fix it. Um, but if it's a really large hole or it's too far forward and the surgeon is not able to view it with the operating microscope, that's when they may have to perform an incision behind the ear. And then what happens when they do the incision behind the ear, they actually elevate the entire outer ear. They just elevate it forward, and that way they can gain access to the perforation. They'll also inspect the hearing bones, the ossicles. Anybody know what the ossicles are? You might also hear it sometimes called the ossicular chain. The stapes is one of them. There's 3 of them. Right, the 3 bones in the middle ear, the stapes, the hammer, and the anvil. Very good. So after they identify the bones of hearing, the hearing bones, they kind of look at it to make sure that it's mobile and that it's functioning well. And then what they do is they'll take a graft, which can either be taken from behind the ear or from the tragus. Anybody know where the tragus is? What part of the ear that is? And I do have a picture of that I'll show you later if you're not sure. Okay, and it's actually part of your external ear. And if you look right in front, right down next to your like next to your jawbone, it's that little part that it's a piece of cartilage, little bitty piece of cartilage, basically. Um, that part that kind of goes, I don't know how to describe it. It kind of goes up in kind of like a half moon shape. Not the piece you pierce, but right above that, in right next to your jawbone, basically. So it's real close to that. Yeah, actually, you're right, Catherine. Some people do pierce that. So, and I'll show you a picture of that, and so you can see exactly where that is. But sometimes they'll take a little piece of that if they need it. I know. I have my ears pierced, but just one hole, one place, kind of the normal piercing. So then what they do after they get the graft that they're going to use, they enter the ear canal. They remove any tissues along the margins of the perforation to kind of clean it up. And then they place the graft beneath the eardrum. And then after that, they just fold the eardrum back over the graft. And they may place some what they call silastic sheeting on top of the graft that helps prevent it from sliding out of the ear. Because when the patient sneezes or blows his nose, it could cause that to move. And then they'll also place a small amount of gel foam material to hold the graft in place, kind of like in a sandwich layer. Then they just lay the eardrum and the ear canal skin. They just lay it back in place. They might put another piece of gel foam over the eardrum, and then they pack the ear. If they had to open the ear, if they had to actually cut behind the ear to get to the eardrum, they would then at that point, of course, stitch your ear back. And usually the stitches are buried in the skin and they're absorbable, so they don't have to be removed later on. And then they would place a sterile patch on the outside of the ear canal. And it's generally an outpatient surgery, so the patient can go home within 2 or 3 hours. They give the patient antibiotics, maybe a mild pain reliever such as Tylenol, or maybe Tylenol with codeine. Um, and then in about 10 days, the patient would come back, the packing would be removed, and they would evaluate whether or not the graft was successful, whether or not it took. They do suggest that you keep water out of your ear, that you try not to blow your nose. Um, if you need, for like instance, if you have allergies or colds, you might need some other antibiotics or some decongestants. And usually you can return to work within just a few days, depending on what kind of work you do. If it's heavy physical labor, it might be a couple of weeks. And then once they figure it's healed after a few weeks, they'll remove the packing and look at it again. And usually about 90% of the tympanoplasty procedure is successful. And they'll usually perform a hearing test after 4 to 6 weeks to see if your hearing has been affected in any way or if it's, even better. Okay, so here's the picture. Here's the tragus. It's this little piece of cartilage right here. And they might use a part of that if they need to for the graft. Okay, so our next uh, operation is called a ossiculoplasty. So this is an operation to repair the ossicular chain. They might reconstruct it and use it to help improve the movement of the ossicles, the tiny bones of hearing in the middle ear. Sometimes these bones can become damaged due to infection, maybe a disease such as otitis media, or some kind of trauma like a head injury. So what they do is they either reshape the bones that are already there so that they work better, or they might even use prosthesis and replace the bones completely. Usually they make a cut either in front of behind the ear, and usually done under general anesthesia. So let me go back one. This opera, and again, the ossicles refer to the bones of the middle ear, the malleus, the incus, and stapes. Um, and these ossicles transmit and amplify external sound to the inner ear. So if they're not working, if something's wrong and they're not working, then of course your hearing is going to be impaired. So generally after they get access to that part of the ear, they like I said, they either cut in front of or behind the ear to get into your ear canal. They'll take your eardrum and they'll lift it with care, and they can examine your ossicles through that eardrum once they lift it up out of the way. And then they'll repair the ossicles, the ones that's damaged or dislocated. And like I said, they might even replace it with the prosthesis if it's needed, if they're damaged beyond repair. They have little prosthesis for like the stirrup or the anvil that they can replace it with. You know what, Corley? I don't know what the prosthesis is made for. I didn't bother to look that up, but that is a really good question. Let me write that down. Oh, and Judy says they use 3D printing. You know, Judy, I think that is so interesting, that 3D printing. I watch shows about that, and I just find that fascinating that they can print something out in 3D, and it looks just like it's was made in the factory or something. I just find that real fascinating, and I think I'm going to have to definitely look into that, because I think that like I said, I didn't even think to look at what do they make it out of, and I think that's a good question. So after you have this, their bones are repaired or fixed. It will, Judy. I think it's going to change organ transplant, but I think probably one of the good things, if it ever happens, would be that more people would get the organs they need. So I think that's a wonderful thing. So after you have this operation, you might experience a little bit of pain. Um, and they usually will evaluate your hearing a few weeks after the operation to see if there's been any change in it. You may have a little bit of drainage of blood or water from the ear, so you just place a piece of gauze over that and to help soak it up in that, and it's usually fine. And some of the complications of the acicular chain repair is a perforated eardrum, wound infection, bleeding or discharge. Could be facial nerve damage. You might have some dizziness, and that usually does resolve. But your taste could also be altered. And the reason for that is the nerve that runs for your taste also runs through your ears. So that may cause some kind of altering of your taste if that nerve is damaged. It could, if they perforate your eardrum, they might have to do a tympanoplasty. And It might happen accidentally. You never know. When they're lifting that eardrum up, it's a very delicate membrane, so it could happen that they might accidentally perforate it. Our next procedure is a stapedectomy, and this is a microsurgical procedure. This is done through the ear canal, and usually general anesthesia or even a local anesthesia could be used. So in this operation, the stapes is removed and replaced with the prosthesis, and it's used to improve the movement of sound to the inner ear and also treat progressive hearing loss that can be caused by otosclerosis. Does anybody know what otosclerosis is? Not necessarily hardening of the stapes, but what happens with otosclerosis is there's the spongy bone hardens around the base of the stapes. So that's why it affects the stapes, because it's hardening around the base of the stapes. So in this procedure, and this one I found some pictures of each part of the operation. They elevate the tympanic membrane. They test your ossicular chain, your those three bones. They test them for motion, and then they remove the stapes. They open up the foot plate, and then they use vein graft over the opening of the foot plate. And then they place the prosthesis onto the incus, and they put the tympanic membrane, they place it back into position. So this is what, yeah, and animation isn't so icky. So this is what it would look like. This is the prosthesis, there's the incus, and there's the foot plate of the staping. And this is the graft right down under here. And if any of you are interested in look at actually seeing any of these, YouTube, of course, has tons of them. And some of them are quite long, some of them are just, fairly short, but there's a lot of them on YouTube. So some of the risk of a stapedectomy is hearing loss. Uh, it could be permanent. Dizziness, because some patients within a day or two of surgery may experience dizziness, but it's not likely to be a permanent or persistent problem. They could have facial paralysis because the nerve that innervates the muscles of the face goes through the ear, and it could affect the movement of the facial muscles for like closing of your eye, making your smile, or raising the forehead. Um, and it might only be partial or complete. So, yeah, and usually it occurs immediately after surgery, but there could be a delayed onset. You could also have tinnitus, which is the noises that you hear in the ear. And then there are, again, taste abnormalities because of that nerve that goes through the ear that innervates some of the taste and salivary functions. But usually that will improve over time. Corley, I don't think it's necessarily caused by mistakes, but because those nerves are all right there and they're so close together, and again, this is a very small area, that could be that, and like I said, some of this is only temporary, so it might be just as part of the operation, just a normal part of the operation. Hi, Roberta. Well, did you have the surgery, if you don't mind me asking? I always find it interesting to hear about when people have some of the things we're talking about. Oh, okay. Yes, Kelly, it could be due to swelling, maybe, and pressing on the nerve also. Oh, Roberta, how interesting. Yeah, I think that losing your hearing is I don't know, I've often had people say, sometimes you ask those questions, would you rather you lose your sight or your hearing? And quite honestly, I can't imagine life without either one. And I know right down the road from where I live is there's a school for the deaf, and so I see a lot of like them being taught how to get around the city. Our school for the not the well the deaf and the blind actually. So I see a lot of times of them, I guess, being taught of how to get around and how to learn to live without their sight or their hearing. It's real interesting. Well, that's good. And they also make these machines that I know because there's actually a girl that I used to work with who is deaf who transcribed and was really good at it. And she had some kind of machine to where she could see what it was that he was saying, and so she could type it. I don't know how that worked, but it was real interesting. It might have been Dragon. I honestly don't know what kind of software it was, but it was interesting to watch. And she was really good. She was very, very fast. Um, so I don't know. There's all kind of things out there for people to help them with their jobs and different things. It's really amazing the stuff that they've come up with. Oh, okay. Okay. Interesting. Here's another one that you'll probably hear a lot of. Some of you, again, may have experience with this, the cochlear implant. So this is a small electronic device that helps provide a sense of sound. It sits behind the ear, and then there's another portion that's surgically placed under the skin. It doesn't restore normal hearing, but gives a representation of sound and helps the person to understand speech. Roberta, is this for the cochlear implant that sound is translated into vibration? Oh, the ability to transcribe without words. Okay. The cochlear implant also directly stimulates the auditory nerve, and then signals generated by the implant are sent to the brain by way of the auditory nerve. Some of the different parts of the implant are the microphone, which picks up the sound from the environment, the speech processor, which selects the sounds and arranges them that are the ones that are picked up by the microphone, the transmitter and the receiver stimulator. The receiver signals receives signals from the speech processor and then converts it into electrical impulses. And then the electrode array are the group of electrodes. They collect the impulses and send it to different regions of the auditory nerve. As far as who can get a cochlear implant, it could be children or adults, those that they are either deaf or maybe hard of hearing. Um, and some of the children can be even as young as 12 months of age, which is actually a good age for them to get it because that's when they're first starting to hear and talk, and that really helps them learn their speech. So this is kind of a picture, and I have another one also here in a little bit, where it shows you how it works in relation to the ear and the rest of the head. And here is the cochlea. That's why it's called a cochlear implant, because of the cochlea. And this is where the electrode array is at. The microphone, as you can see, is behind the ear. Your transmitter is actually on your skull, and then the receiver stimulator. And the speech processor, all of that is kind of on the outside. And I don't know if y'all have seen recently. There's been a lot of videos on Facebook coming through of people when they, whether some of them are babies, some of them are adults, some of them are teenagers, whatever age. Uh, Basically, after they have one, and the first time what they hear, when they first hear it, and kind of the look on their faces, and those are always really neat to watch. So the cochlear implant, the surgery is done in the hospital under general anesthesia, of course. Um, and usually patients can go home on the day of surgery. Not always, they might have to stay overnight, maybe especially if they're young, but sometimes they can go home the day of surgery. So the internal parts are placed under the skin behind the ear, then an incision is made behind the ear, and the mastoid bone is opened that leads to the middle ear. A depression is made in the bone next to the opening, and the receiver stimulator sits flush with the skull surface and held in place with the suture. So here's what it looks like, kind of a picture of a head. And so here's the transmitter. And I'm not sure, I think I saw a question of how much it's visible. Now, Corley asked, is it quite visible from the outside? Okay, thanks, Corley. Um, Corley, I'm not sure how visible it is. I don't think it's real visible. I was looking for, a picture of like an actual person, but unfortunately, all the ones I found, usually it looked like they had just been in transplant or implant. Of course, the head was shaved, so they were, of course, visible. But yeah, I'm thinking that depending on the length of hair, that kind of thing, that it wouldn't be. Yeah, because what they do is they shave your hair, they put it on, especially that transmitter part, and so if you have long hair, it would grow back over it. So that's kind of what it looks like. And so that's kind of interesting. Yeah, Roberta, I would think so. So that you would know what's going on. Otherwise, they might miss something if you don't understand that they have a cochlear implant. Oh, Judy, I bet she does. So the next one we're going to talk about is a cholesteatoma. And this would, especially if you if you type especially for an ENT doctor, you'll see this a lot. One of my first accounts was an ENT doctor, and I think he probably did two or three of these a day, where the patients had cholesteatomas, and they would have to go in for the surgery and get that cleared out. So it might be something you actually hear the term a lot. So basically what a cholesteatoma is there's an abnormal skin growth in the middle ear behind the eardrum. And so the skin of will grow through the hole in the middle ear. If there's an infection, the skin will continue to grow and into the middle ear and becomes a tumor of the ear termed a cholesteatoma. Now, you need to know that these cholesteatomas are benign tumors, are not a form of cancer. A lot of people, when they see that OMA prefix there, they automatically think cancer. And it doesn't necessarily mean it's cancer. It could be a benign tumor. Some of the symptoms include hearing loss, and it could also recurring discharge from the ear. The patient might have pus or maybe some foul smelling fluids coming from the ears. And this is a picture of a congenital cholesteatoma. This is one that the person's had since birth. So they can be congenital, or they can start, even as a child or maybe as an adult. I think it's mostly children that get these. Cholesteatomas can destroy the bones of hearing, the ossicles, especially if the ear is infected or if water gets into the middle ear with other kind of infections. Symptoms of cholesteatoma include a hearing loss, and again, the recurring discharge from the ear, the pus or the unpleasant smelling fluids coming from the ear. So in order for a doctor to tell if the patient has a cholesteatoma, they'd have to use a surgical microscope and then just kind of look at the ear to see if there was one. They might have to clean it if there's an infection. If the patient has a history of recurring ear infections, or they do a lot of swimming and they get water in their ear, then they need to have their ears examined regularly for this condition. Some of the ways that they might use to also determine, they might do hearing and balance tests or even CT scans, and that will help them to determine the hearing level and the extent of damage that's caused by the cholesteatoma. If it's just a small cholesteatoma, they might be able to use things like, ear drops, antibiotics, just cleaning the ear, and that to help clear it up. If it's a large cholesteatoma, it would require surgery. And again, surgery would be done under general anesthesia. Primary purpose, of course, would be to remove the cholesteatoma. They also might have to do a second surgery to make sure that the cholesteatoma is removed, and also if they need to reconstruct any of the middle ear bones that have been damaged. So here's a picture, kind of a drawing. of what the cholesteatoma might look like. As you can see, the eustachian tube is blocked by in the tissue, the inflammatory tissue. The middle ear space is filled with the cholesteatoma and the bones are eroded, so this is a bad one. And then the tympanic membrane is perforated. So if something like this was to happen, they would have to maybe do several different types of operations, not all at the same time. They might only try to do it in stages. Corley, I don't think it's common to have it in both ears. It's not something I've ever heard of. Not at the same time. You might have it in one ear and maybe they'll fix it and then maybe later on you get it in another ear, but it's usually just in one ear. And that was my last one. Any questions or anything y'all want, any comments? And again, like I said, if you have a mic and you want to use it, I can unmute you and so you can use it. Absolutely, Judy. Absolutely. I think it's something we all need to do. Thanks, Catherine. I'm glad you enjoyed it. And there are a bunch more. These are just some of the more common ones, but there are tons of other operations out there. And I think as transcriptionists that it helps to, and like I said, if you can do it and actually watch some of these operations, see how they do, listen to the doctors talk about the different instruments they use. And it really helps us to learn and understand the reports that we're typing. Yeah, it's important to get your ears, your hearing tested, all of that, uh, just to make sure everything's okay. Oh, okay. So you're able to do it without the operation, so you can still hear just maybe some of the lower ranges that you can't pick up on. Bye, Judy. You have a good day. Anybody else have any questions or okay, well that's good, Roberta. Yeah, I don't know what I would do without my hearing. I would hate to lose it. I like listening to music too much. Well, thank you, Catherine. Bye, Anne. You have a good week. Thank you, Shara. I will enjoy Survivor tonight. I'm even taping it just so I'll have it. Bye, Tracy. Have a good day. Thank you, Roberta. This will be, I did I did